Hi, I'm Sofia. I'm 5 years old. Help kids that don't feel good, like I helped my brother. Thank you.
I have known these two people for either their whole life or almost all of their life. We are connected through a lot of time we spent together early in life and have maintained a lifelong connection. But I came to know Andy and Sofia through my work as an immunologist, and really at the very beginning, trying to figure out why Andy was sick. That led to a lifelong connection, and I must say, it is an absolute privilege to be sitting here with the two of you, and it is really surreal. While I stayed very close to the Trevinos, I was only involved very directly in Andy's care for a brief period of time at the beginning of his life. But our bond, our connection was something that had lasted until this day, continues on, and I gained such inspiration from Andy, Sofia, from the whole family. I've learned so much about humanity. I've learned so much about what it means to be human from the people I'm sitting with right now.
I didn't fully realize I had PI. I didn't really realize what I had. I just knew that I was in the hospital. My time in the hospital when I was little, it was a lot of just being in bed, sitting around, having treatments done, blood transfusions, all that. But me and my dad and my mom, they all made it fun for me. Even the staff, they made it fun for me. From the clowns to the nurses. We had like dance parties in my room. The clowns would come in and entertain me.
So we met many years ago, and we met many years ago in the context of Andy being very sick and really trying to understand why. And Andy's parents had taken him world over to try and get some answers. And answers weren't easy. Answers weren't easy for anybody that had seen, and answers certainly weren't easy for me and the people around me. But we worked really hard, and that's a really important story, and we did get to an answer. It was fair to not know what it was he had, because at the time it didn't have a name. It was clearly primary immunodeficiency, but what kind? And the long story short is that we eventually figured out, with the engagement of so many people, that it was Nemo. But we also realized that given the type of Nemo that Andy had, that his best chance was probably with a bone marrow transplant. The process that is commonly known as in vitro or in vitro fertilization, which is commonly used by couples that have fertility problems to help them have children, can be used, but to allow for the testing of the fertilization to check on some things, check on whether there's going to be the same disease, the same primary immunodeficiency, whether there's going to be Nemo, and whether there's going to be a bone marrow match. So after much intense discussion and consideration, the decision was made to go for it. And I will never forget the day when your parents, Sofia, sent me a picture of what was going on in the dish. They sent me a picture of you in the dish, and I have a picture of one of the embryos that you were, and still have that picture. And another great picture I have is of the ultrasound of, you none of this big, but that was a pretty glorious day and moment. One thing I want to be really clear on, because I was there, is that boy, did your parents want to have you.
Yeah.
Boy, did they want to have another. They wanted to have another child. They wanted to have a big family.
Yeah.
But they were afraid, and the fact that they knew they could have another child who wouldn't suffer in that way, could be healthy. I could see just how much hope that gave them.
So Dr. Orange came into my room one day in the hospital, and he brought a snow globe in that had Boston, the Boston city skyline, and he shaked it, and he said when it snowed outside of the hospital in Boston, that I would get better, and it did snow a couple days after I began getting better.
In our family, Dr. Orange is like a magical being, kind of like especially my dad idolizes Dr. O, and to the point that he got an orange Jeep. Like to this day, he says that his favorite color is orange, and there's no way that it was orange prior to like Andy's care. And then he would always wear his like orange tie to like symbolize Dr. Orange. So since Andy was in the hospital growing up, there was a lot of overlap with how we learned things. For the first couple months of my life, or like the first kind of year, Andy was still in and out of the hospital. And eventually, when I was like big enough, we both like learned how to like go on the swing set together. We were like learning side by side biking, and like we lived in a little cul-de-sac, so we really had like full reign of our little cul-de-sac. So we went everywhere with like our neighbors.
So living with primary deficiency, of course, has some downsides. Like I don't sweat, and I had some dental work done, and currently having a lot of dental work done. But I just lived my life as I was a normal person, just every day.
My teeth used to break all the time. So like when people would ask me like, oh, like why do you have the fake teeth? And I'd have to describe like I'm a carrier of a primary immunodeficiency. I just give like a very short story of like what happened. I'd be like, oh, I just gave my bone marrow to my brother because his immune system didn't work. I basically would just say in like the simplest terms, like his immune system didn't work.
So it's been 20 years. Last year was 20 years. I'm just looking forward to doing what I like, having a career in what I want to do, and just keep advocating for primary immunodeficiency.
In the future, I hope that we can expand newborn screening, obviously, and not only for people that are obviously directly affected, but also for carriers. And in the future, I hope to keep working in the rare disease space and keep advocating for my brother, for carriers, and for anybody else affected by a disease that's considered rare.
And Vicky and Fred always, despite trying to change the world as it relates to primary immunodeficiency, made it very human and made it very personal. You got to know everybody, encouraged everybody, connected with everybody, tried to support everyone they could.
I remember Vicky and Fred, like, obviously I've known them since the day I was born. It was just like a family dynamic between them.
Yeah, they always greeted us and treated us as family.
They wanted everyone affected by primary immunodeficiency to feel that they were part of their family, and that I think first and foremost it is a very human thing.
I'm helping out at JMF, which is the foundation that practically saved Andy's life and gave my parents the idea to have a stem cell transplant.
And the primary immunodeficiency community is a global community. There are centers of excellence around the globe. There are experts around the globe. connected through the Jeffrey Modell Foundation. They're connected in so many different ways. But it's important to be connected to that community. For somebody navigating a diagnosis of primary immunodeficiency, to be sure that you've got connection to the global community of people working to make a difference, devoting their lives to making a difference, because there's a difference to be found. The state of something today, tomorrow is going to be in the past, and tomorrow may look different. And we work hard to be sure that tomorrow looks different. And sometimes tomorrow doesn't come fast enough. But oftentimes tomorrow holds great inspiration, and tomorrow holds that miracle